Okay, guys, let's try that again. Here's a concise page grounded explanation of the headline: Why Office Based Care Matters, Especially in Rural America, based on the surrounding reporting and analysis. Summary of argument: Office based care refers to medical services delivered in outpatient clinics, physician offices, community health centers, and rural health clinics, rather than in hospitals. The surrounding page argues that these settings now deliver many procedures and chronic care services that once required hospitalization, and that keeping care local is essential for access, cost, and community, especially in rural communities. Why office based care matters in rural America. Access and proximity. Rural areas have fewer hospitals and specialists. Office based clinics are often the only nearby source of primary and sometimes specialty care. So they are critical for timely diagnosis and treatment. Lower cost and less disruption. Many procedures that used to require long hospital stays can now be done in outpatient settings, reducing costs and the burden on patients who must travel long distance. Chronic disease management and prevention. Rural populations have higher rates of chronic conditions and old age profiles. Continuous local primary care delivered in offices or community health centers improves disease control and preventative care. Workforce and local economy. Office based practices and community health centers employ local clinicians and staff, supporting rural employment and keeping clinical expertise in the community. Evidence and examples from the page content. Medical advances shift care out of hospitals. The article notes that many cardiac and surgical conditions now use minimally invasive techniques or same day procedures, making office or clinic settings appropriate for care that previously required hospitalization. Community health centers. CHC's role. CHC and rural health clinics provide comprehensive, affordable services in underserved areas and are cost effective anchors for rural primary care. The page highlights the long history and continued importance. Primary care strain in rural, specifically national beliefs cited on the page show primary care is underfunded relative to specialty care, and rural primary care faces unique workforce and infrastructure challenges that make office-based models both necessary and fragile. Systematic challenges the page highlights: payment and reimbursement mismatch. Payment systems still favor hospital-based or procedure-driven care, leaving many office-based clinicians undercompensated for the complex longitudinal work of primary care in rural settings. Workforce shortages and burnout. Recruiting and retaining clinicians in rural offices is difficult. Fewer providers mean heavier work or caseloads and higher burnout risk, threatening the sustainability of local office-based care. Infrastructure gaps. Broadband telehealth support and capital for clinic upgrades are uneven in rural areas, limiting the ability of office-based practices to expand services or integrate virtual care. Solutions and policy directions mentioned on the page. Value-based and accountable care models. Programs that reward outcomes and population health rather than volume can help sustain rural offices by aligning payment with the preventative and chronic care work they do. Support for CHCs and rural clinics. Continued funding, workforce programs, and targeted investments in telehealth and infrastructure strengthen local office-based capacity. Local centered strategies, tailoring solutions to rural realities, flexible staffing, mobile clinics, and partnerships with larger systems help preserve access while addressing workforce and financial pressures. Bottom line, office-based care is the backbone of rural health. It delivers accessible, cost-effective, and continuous care for populations that are older, sicker, and farther from hospitals. The page argues that preserving and investing in office-based models through payment reform, Support for community health centers, workforce initiatives, and infrastructure will be essential to closing rural health gaps. Okay, now we're going to get into the state of rural primary care in the United States. Concise summary. The report documents that primary care is under strain nationally, and that these strains are especially acute in rural communities where older populations, higher chronic disease burdens, and fewer clinicians make local primary care both more necessary and more fragile. Key findings. What the page emphasizes: lower clinician supply in rural areas. Rural communities have fewer primary care physicians per capita than urban counties, even as nurse practitioner and physician assistant supply has grown. UW, Department of Family Medicine. High and rising demand. More than 60 million Americans live in rural areas. Many face greater travel distances and rely on local clinics for routine and urgent needs. Care shifted out of hospitals. Advances in outpatient care mean clinics now deliver many services that once required hospitalization, increasing the scope and complexity of office-based primary care. Gaps in access and use of emergency care. A substantial share of rural adults use emergency departments for problems that could be managed in primary care, signaling access shortages or shortfalls. Causes and drivers, the page highlights workforce shortages and misinterpretation. Fewer physicians choose rural practices. Growth in non-physician clinics helps but does not fully close the gap. Payment and investment patterns. Primary care receives less relative investment than specialty and hospital care, making it harder to sustain comprehensive rural practice. Demographic and health needs. Rural populations are older and have higher rates of chronic conditions, increasing the need for continuous local primary care. Consequences described on the page: worse access and delayed care, travel burdens and clinic closures lead to delayed diagnoses and more acute presentations. Financial and operational fragility. Small rural practices struggle with thin margins, staffing, instability, and limited capital for technology or facility upgrades. Policy and practice solutions. The page recommends targeted workforce programs, incentives, training pipelines, and support for rural practice to recruit and retain clinicians. Payment reform and value-based models. Shift from volume to outcomes and population health payments to better fund longitudinal primary care work, strengthening community clinics and telehealth. Invest in invest in community health centers, rural health clinics, broadband, and telehealth to extend services and stabilize local access. Okay, bottom line, guys, the page frames rural primary care as a critical but endangered foundation of U.S. healthcare. Preserving it requires workforce investment, payment changes, and targeted infrastructure support so rural clinics can continue delivering accessible care. All right, guys, that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness, take care, folks.